Thoracic outlet syndrome. Thoracic outlet syndrome occurs when blood vessels or nerves are compressed by the collarbone or muscles, leading to pain and numbness in the upper back, neck, shoulder, arm, and hand. Also, the common points of compression that includes scalene triangle, costoclavicular junction, and interpectoral. Special tests for thoracic outlet syndrome are Roos test, Edson maneuver, military brace test, Wright's test, and Allen maneuver. First is Roos test, also known as EAST, that is elevated arm stress test, hands up test, AER, that is abduction and external arm test.
Sitting or standing, therapeutic position behind or beside the patient. First of all, instruct the patient. Abduct the shoulder 90 degree. Okay, lateral rotation of the shoulder and flex the elbow 90 degree. And then tell the patient to open and close the hand for 3 minutes. Okay.
So Roosters is positive if patient is unable to hold position for 3 minutes or patient feels heaviness, ischemic pain, weakness, tingling or numbness of the hand for these 3 minutes. Test is positive due to compression of the neurovascular bundles at the rectopectoral minor space. Test is negative if patient feels minor fatigue or distress during the test. The next test is Edson maneuver.
Next test is Edson maneuver test. In this test, patient position is upright position and therapist position beside the patient. Now ask the patient to take a deep breath throughout the procedure. After that, instruct the patient to rotate her face towards the tested side. Now, after that, ask the patient to extend the hand. Now, the therapist will palpate the radial pulse while extending the shoulder and laterally rotating the shoulder for the 1 minute. Test is positive if the radial pulse is diminished or absent.
Edson maneuver test is positive if there is absence of radial pulse on the tested side, indicates compression in the scalene triangle. So next test is costoclavicular syndrome or military brace test.
So next test is a costoclavicular syndrome test or military brace test. In this test, patient position is sitting on a stool and therapist position besides the patient. In this test, patient face is neutral. The therapist draws the shoulder downwards and backwards and palpate the radial pulse for 1 minute.
Military brace test is positive if there is absence of the radial pulse on the tested side, indicates the compression in the costoclavicular space. Next test is Wright's test, also known as hyperabducting arm test.
So next test is the Wright's test or hyperabducting arm test. In this test, patient position is sitting upright position and therapist position back to the patient. Now, patient face is neutral and we instruct the patient to take a deep breath in procedure. So, therapist palpates the radial pulse and passively abduct the arm to 180 degree for 1 minute.
Wright's test is positive if there is absence of the radial pulse on the tested side. Allen maneuver, modification of the Wright's test.
Wright's test is Allen's maneuver test. In this test, patient position is sitting and therapist position besides the patient. Ask the patient to rotate the face towards the affected side. Now instruct the patient to abduct the shoulder at 90 degree and then laterally rotate. After that, ask the patient to flex the elbow towards the 90 degree. Now, therapist palpate the radial pulse for the 1 minute. Test is positive if the radial pulse is diminished or absent.
Allen-Manuel test is positive if there is absence of radial pulse on the tested site.